capacity in this hall. Some of you might be meeting each other for the first time, so welcome. Obviously, this is a very special time, special day, and we wanted to celebrate it with you, right? And it's a major milestone, something that you've probably been looking for a while, because hopefully from now you should be able to identify yourself as a clinical student, right? So you sort of suffered through years of classrooms, practicals, and now you're going to be able to practice and apply a lot of the skills that you've been dreaming about for a long time. So we wanted to celebrate this and bring to you a tradition that was first introduced in the medical field, where the white coat comes from. But obviously things move on, and we know that white coats are formats. So we have modernized ourselves, and purple top ceremony just didn't sound anything appealing. So we kept the name, but the tradition is the same. And one of the things that also makes our approach to the ceremony, which has been running for over 10 years, is that a lot of it comes from what the next, or the outgoing class has to share with you. So it's like passing on the baton. And that's how it started. It just started as an informal chat with pizza, and the final years would share a few thoughts. But we just bring that events because we realized that this is something that people have been looking for a very long time. So before I get to a bit of the inspirational talk, I'm going to introduce you to the final years because this is really the highlight. They're going to be sharing their real experience, telling you what they believe will be the best thing for you to know. It's we have no sight of what they say. We wanted to be honest, so it's coming straight from them. And we're here to support you in your journey. So I'm just going to introduce you to your final years, and they're going to share with you a little presentation to go through. And it's in your Google. All right, so here you go. You guys are on. There's some microphones.
Hey guys, so this is our rotation survival guide slideshow, obviously. My name's Tiana. I'm planning on going to equine next year.
I'm Kaz. I'm planning to be a mixed vet, we think. Still undecided, but heading back to Australia next year.
I'm Priya. I'm planning to be a farm vet next year.
My name's Vin. I'm on these smallies, probably stay here, move to the States, not sure yet.
I'm Zach, and it's still being decided.
I'm Vin, and I'm doing next year.
Okay. Not that you can see it. You want to?
Okay.
You might be able to drag it over sometimes the window if you grab it on your screen and then drag it.
I'm a bit technologically challenged.
Bear with us. Technical difficulties.
Get the window and drag it to the, yeah, there we go.
Sorry, it's worked away.
So this is Microsoft and Google are no friends of people.
Okay. Well, we know what's going on.
Okay, nice.
So this is the learn page. Click the next one. This is where all the important information for rotations is going to be. So you want to know the progress.
I really recommend bookmarking it as well. It's going to be a bit of a nightmare to try and get to. You have to click all the arrows and all the menus. So if you bookmark it, it's just on your laptop.
You can find all your core and your track rotations here, and then you can also find your grade book, and there is a lot of information on each of the different pages, so I suggest reading them before you start a rotation, because some super obvious questions will just be explained there.
You can, if you didn't choose a track but you're still interested in it, you can read the other tracks as well. So there's a lot of good farm resources, for example, on there.
That's your grade book.
Stuff about exams will be under the assessment tab, so look on there for the important stuff. But you've got a while before you need to worry about that. You don't need to know about the stuff, that's nothing from COVID, so
Just
ignore that.
Just still there, just still hanging around.
So on some of the rotations, like for example, it's non-internal medicine, which I believe for you guys is reduced to 1 week versus we had 2 weeks. You'll have to do walkouts and on-call shifts. So again, it's rotation dependent, but it's in the name. So for walkouts, for example, on internal med, there'll be like night shifts, for example, and you'll go back to the hospital after your shift and bring certain patients out depending on who's in the ward. For walks and to go to the bathroom, fairly self-explanatory. Some rotations have weekend shifts, some don't, and yeah, similar with the on-call, but all of that is explained on the learn page for that rotation, so it's all where we've kind of already talked about.
Walkouts only last like half an hour depending on the shift that you're on. Sometimes if there are a ton of animals in, you're there for 2 hours. But if there's 3 in, also talk with your group, and if there's 3 assigned to walkouts, like you don't all need to go either. Someone can take the night off.
Yeah, it's like really dependent on like how many patients you have, like how busy the ward is, for example. Yeah, most of the rotations are like 2 of you each night. Maybe just one of you have to show up most of the days, but it's just variable, I guess, about what's going on in the wards.
Check with the nurses, because sometimes if there's any X-ray patients, they'll do them.
But I'd say that's like dependent on the service you're at. Like if you're in neuro, for example, I found the neuro nurses are quite like nice at being like, you know what, we'll just do him. It's just 3 dogs that might come in this evening. But like if you're in medicine, for example, there'll be 1 dog and they'll be like, you know, you need to come in to do this. It's your job. So don't take it for granted. Just like gauge what, like, you know, who the team is, if they're trying to be nice or not. Anyways. This is just like a breakdown of which rotation has walkouts, on calls and weekends. Yeah.
I think the most important thing it comes to with on-call and weekend shifts is just make sure you negotiate well with your group. Like just try and make sure it's fair for everyone. Don't have that one person who's always doing the extra shift if it's not even. Like try and make it fair.
And like your roles will differ slightly whether your weekend shift is in the morning versus evening. For example, like if you're in the morning, it's your responsibility like TPR all the patients, change the IV bandages, that sort of stuff. Whereas if it's in the evening, you just have to go take the dogs out because those checks have already been done by someone else in the day.
Yeah, so you guys you might know about these already. So there's 7. So it's, you've got the list there. Then basically different rotations will be whether or not you're able to do them. Some rotations are better than others. We made a fun little, like, it's on the next slide, we made a fun little table. We didn't make a fun little table, the year before us made a fun little table and we've stolen it. And we've slightly edited it. But yeah, just knowing when you can get those, some of them, you just have those rotations last, so it might take you a little bit longer to get your e-docs. But I think the thing is just give it a go. Like a lot of the time, even if you fail the first time around, it doesn't matter. Just like give it a go, embarrass yourself in front of the nurses. You'll have a good laugh together and then you try again. Like it's very chill.
Do them in front of the interns, not the nurses.
Yeah,
The interns will be a lot easier. It depends on the nurse, but the interns are really nice, they're really giving, they don't care. Whereas some of the nurses, like, if you put something outside of your little blue box, you fail. So
Yeah, good point.
Equine's a good one, especially for vaccinations, they don't care. But also make sure you follow everything up with an email to remind them to fill it out, because they often forget.
Yeah, email or Teams them and pester them in a nice way, but pester them.
Zachary?
Oh, well, yeah, so here's the equipment you need for the rotations. So some people get really, really stressed out if you forgot they didn't bring the thermometer for the week or the day, or they lost it. Like, don't stress too much. You're not going to fail a rotation because you forgot to bring a stethoscope or thermometer one of the days. But it does look better if you have it, because sometimes it might just be like, can you take a heart rate, and when you don't have it, it's always a little bit awkward, but it does happen a lot. So scissors is definitely one that I would recommend. I think I remember when I was at ECC, there was one scissors and 5 people queuing up to use the scissors. And on ECC, when you've got a dog that's kind of in a critical state, and you just want to cut it, and you're just waiting for the scissors to finish, so get your own scissors. That's really important. So I would definitely say the top 3, more emphasis on scissors. And then for farm, just the typical, so just your waterproof and your wellies, and it can get quite a bit cold depending on where your CNG block is. So definitely bring warm clothes and hand or foot warmers, and for equine, just similar to what you've already been bringing, just your boiler suit and your, the steel toe wellies. Don't stress too much about the warm clothes as well for equine, because it's quite warm in the barn, and we aren't really out there that often anyway. I can't speak the same for the track equines,
Chuck Bringos.
Yeah, going to depend what time of year you do these things. Obviously, my equine was really busy, so we spent a lot of time outside. Just make sure you have all warm layers and stuff. It's the kind of thing you can, bring it with you and chuck it in a corner somewhere, and even if you don't need it, it's better to need it and not have it. I also have a counterpoint about scissors because actually we went through in our equine rotation, I think we went through about 5 thermometers between the 7 of us. So, but all these things you can often get spare spaces. It's not a huge stress.
The farm have a spare pair of waterproofs. They will get wet and they do not dry very quickly.
Another thing for equine, because I know it was my first rotation, a lot of us were curious about it. For when you do your first opinion week, because on equine one you'll do 1 week in hospital, 1 week first opinion. You don't need to stress about a boiler suit. You kind of wear any nice clothes, as long as you just look smart, professional, we're fine. It doesn't have to be a boiler suit all the time. But in hospital, it has to be a boiler suit.
Lovely. You're up. I think you guys had to talk about this today, so I'll try and keep it brief. And apparently there's an earlier sitting now from mid-October that you can do, but the first one's October to December. And as you guys probably know, very different exam to what RVC normally does. It's multiple choice. It's draining. The exam itself, it's not actually intellectually hard, it's just draining and a lot of information. There's lots of resources that the RVC gives you, so do try to use them. They're on Learn. They give you that prep. What I did and found really useful was on my rotations, I did the PowerPoints and the power slides. So if you do them during internal med and you have a diarrhea case, use those slides as you're studying and then go over your notes as well. Because then if you do those questions that day, it kind of solidifies the information and it just helps you study quite early. And it's all purchased for you, so you don't have to pay for that prep. They won't reimburse you, so don't buy it.
I think the hardest thing about the NAVLE prep is just as Sienna said, it's draining, because sometimes after a rotation you just want to go and chill out, but you have to go do 70 vet prep questions, which is tough after a few months of doing it. Don't let it build up. If there's one piece of advice I can give you, just chip away a little bit at a time, because it'll add up in the long run. Don't think that you can do 300 questions and the back end of it. Just try to chip away slowly. There's a lot of it with multiple choice is that you see the pattern, you see the questions again and again, and you kind of know what they expect from the answer, which is different to what we're taught at the RVC. But you just recognize the similar patterns again and again, so you get better at answering the questions, and that'll happen if you do it over a longer period of time.
The exam is purely pattern recognition, nothing else. I can read one question in the first 5 words and I'll know what the answer is because they're all worded the same way.
Yeah, that's a big thing. I would agree as well. I find that actually studying for the NAVLE is kind of a game. You have to learn to play the game rather than necessarily studying material. It's a balance of both. So it's definitely not easy.
This is just all the info you have.
Right, so this is more about rotations and your experience on rotation. So I just want to talk about kind of experiences we've had. So I want to preface this by saying I've genuinely had a really good time on my rotations. I think it's really daunting and scary. When I was sitting here, almost a year ago, not quite, but it was, yeah, but actually coming into them, they've been really, really good fun, and you know, I've had a great time, and I actually think I'll be a bit sad to finish, and I think a lot of us will feel the same, maybe not, it depends on the week, but you will obviously have tough days. It's a long old road, and you will have some tough days, but it's worth it in the end.
Definitely much better than lecture.
Yeah, so much better than being on lecture. So much better. It's really fun. You get to be like, oh look, I'm a vet, but I don't actually have a lot of responsibility yet, and that's quite nice. So like some just general like welfare advice really is what we want to go through here. So just stuff like look after yourself, like get enough sleep if you can. Try and eat well, meal prep if that's your thing. If you're the kind of person who likes exercise, do that. And just the most important thing is don't go all in the first week. Don't if they tell you to go home, go home. Don't be a martyr and stay for hours and hours after because you think you'll get better results or something. That's not what it's about. It's a long road. It's a kind of marathon, not a sprint, to use a bit of a cliche. But just to keep going as you are, and not to kind of burn out all in one go, and then have 8 months left of rotations and be really, really exhausted.
I'd recommend to factor in breaks as well throughout your rotation schedule. I know you guys get debrief weeks, which is quite lucky we didn't get that. So you might have time off in between some blocks. But if you don't, you may think that I can dash out 4 rotations and go do 8 weeks of EMS and be fine. No, especially if you're doing other stuff like Natalie and things as well, that catches up to you and you get really burnt out. So factor in small breaks. I think that's really useful.
Have some downtime. Don't be afraid that you're not studying 24/7. You shouldn't be. Do things you enjoy, do usual things. Get outside every single day because some buildings don't have any windows. And get very crazy after a while. So just go for a quick walk with them or something like that. Yeah.
They won't remember who you are. There's no point in trying to impress them. It's a pass or fail. All you need to do is pass. If you're staying, like I said, for 5 hours later, they don't care. Truly.
Yeah, unless you're super, super keen, just look after yourself, basically. And do some fun shit on your weekends. Don't try and spend it all studying. We've been planning trips still and hiking and whatever.
Before I talk about the driving, so one thing I would also alluding to the previous slide, you get 1 sick day off a week. I'm not saying
2. No, 1 a week.
1 sick day a week, 1 sick day a week, and 2 basically 1 sick day a week. And sometimes people are really worried about taking that sick day off, and they'll just go into rotations because they're worried oh, if I miss this 1 day, I will fail rotation. They really won't, as long as it's reasonable and just inform them. I know some people just actually walk into rotation really, really ill, and honestly, it's more professional if you took the day off and informed them beforehand than trying to go in and do the rotation. So don't be afraid to use sick days. So I'm just going to talk about some common problems. So I'm just going to do the first one. So I don't know how it might have been this year, but usually the way they can allocate rotations is I think they did ask a question whether you drive or not. So they do try and allocate a set number of drivers, so it's usually 2 drivers per group. However, what you do have to remember is that sometimes that one driver may be sick, or for example, in the case of Navle, they kind of have to swap the rotations a little bit, or due to unforeseen circumstances, and we did have quite a few groups this year, just be stuck without a driver, and they were kind of in a bit of a dilemma because a lot of people also didn't have driving licenses. So what I would recommend, getting a car is quite a commitment, but I would recommend that if you're in the middle of getting a driving license or having converted, in the case of I think some Commonwealth countries, definitely look into doing that before rotation. As we mentioned, once rotation starts, if you're going to be really busy, you're not really going to have much time to deal with your driving or thinking about converting, I would recommend get that done ASAP just in case. You don't have to drive, but it is handy to just have a license as just in case you need to rent a car, as in the case of some groups. Or otherwise it is quite a kerfuffle when you kind of have to move the groups around.
Canadians can just mail their driving license in and they just get a UK driving license back. for automatic cars, so it's super simple. I think I paid like £35 or something. So I would just do it, because it makes your life easy.
In terms of the other problems, you will probably use a thermometer, a watch, scissors. Try and replace them if you can. And FAM 30 on farm kills your thermometers, so don't come in a bucket, wipe them down instead.
FAM 30 also kills the back of your car. Have garbage bags and stuff in there to protect if you're as efficient as you know.
Yeah, also on farm rotations, be hygienic, wash your hands, otherwise you might get ill. So just be sensible.
It's not like you will get
Yeah,
ill.
there's a bug that we shall not name.
Lots of people got sick.
Yeah.
Lots of people got sick. Like, wash your hands. Do not eat if you haven't washed your hands. Like, I know so many people that I know people who are hospitalized because they got sick. So just clean.
We also want to talk about like we talked about living up on call and stuff and that being trying to make that as fair as you can. And then just the other one is like if you know from the very first day of vet school and you haven't known the whole time you want to be a small news vet, absolutely fine, go for you. But if you're going into your equine rotations already dreading it before you set your foot through the door, you're gonna have a dreadful time and you kind of set yourself up for that already to start. So even if you never want to touch another horse in your life, try and give it a go, try and have fun, try and get something out of it. Even if it's just, oh, I spent a week kind of playing with horses and I'll never get an opportunity to do that again. Or I saw this scan that I might never see again. Like that kind of stuff. Just every rotation you do, you probably won't ever get an experience quite like that again. So just try and make the most of it if you can. Even if, you don't give a shit about cows or whatever.
I'd say that is, yeah, especially true for like all the farm rotations, because like smallies going through a farm thing for 4 weeks may seem a bit like daunting, but synergy is actually really fun. Like the way this laid out both the rotations, it's like fun, so you'll enjoy yourselves. Just keep an open mind.
Yeah, we had Endel, it was like summer camp. It was good fun. You're with your rotation group for like 2 weeks and you just have a good time.
Also, in regards to synergy, so this is a really new thing. Uber does cover, so you can actually Uber Eats to like both synergies. I know people who before synergy way too good. They panic. They were like, oh, I'm going to be the farm. I'm in the middle of nowhere. I'm relying on another driver. So they were like, I'm just going to go buy like 5 bags of shopping to keep you going for the next 2 weeks. You don't need to do that. I don't know whether it was the same for previous years. You can just call her, or I think Bolt also, no, is it Bolt or Just Eat, I think? Yeah, so it's never shot and like quite literally like it can be quite fun. So for Synergy A, we're on the shop campus, so a lot of times in the classroom during the day, you can literally even like meal prepping. We did mention meal prepping as a friend, but in some cases you can just Uber Eats. Like, and like it's also cheaper than London and what it's far. And also regarding making reservations, definitely do try that. You never know. Who knows? Like a lot of people are just like go in saying, oh, I'm going to do smallies, but then you might actually discover something new. You might decide you like equine, because I feel a lot of it also comes from the fact like there's minimal exposure to like those previous species. So yeah, and like I know some people who always go into rotations being like, oh, now I want to be a neurologist, and the week after they're like, oh, I want to do whatever rotation I'm doing. Like yeah, it's like just make the most of it. Yeah?
So final points, all the staff are generally really lovely. Make friends and chat to your interns, residents and nurses, like they'll help you settle in, and just, yeah, don't sort of blank them or think they're too scary, they're really nice.
Yeah, never be afraid to ask, even if it's a really stupid question. Like some of the stuff in, the QMH, whatever, it can seem a bit like it's a maze of what should I do now, of forgetting about all the jobs you have to do. But all those kinds of things you can ask and they'll be so helpful. So yeah, don't be afraid.
However, in the case of some interns or whoever staff not being nice, do not bottle it up. Be sure to speak up. There is feedback sessions. They do tell you who your rotation leader is. You have access to them on Teams. If you truly do feel that like you're not being treated well on rotations, or like something happened, like a lot of people bottle it up as well. Just make sure to like tell someone before it kind of gets out of control, because that also contributes to burnout and also like affects your like enjoyment of rotation as a whole. So if you have a problem, just speak up.
Yeah, that's pretty much all we have, I guess. Should we just open up to questions or something now?
Yeah, go.
They will grill you, residents, they will grill you, but it is good. One thing someone told me was, start getting comfortable with being uncomfortable, because if you're sitting there by yourself in front of the resident, it'll be awkward when you don't know the answer and you sit there in silence for 2 minutes. So, it just happens. It happens to everyone. Don't feel stupid. Go read up on it, get better.
And that will stick with you, like you'll learn it so well because you remember that traumatizing experience. But they're not generally trying to scare you, it's genuinely, they want to know the limit of your knowledge, and if that limit is further than you want it to be, it doesn't matter, it's just how it is. And it's only 1 year, so like, have a good time, like try and make the most of it. Yeah.
Right, so this is the opportunity for you to ask questions directly to them. So you've been asking questions of the staff throughout the week, but this is your chance. Like I said, we're not censoring or filtering this. So, just for the people that are watching this, I think there are, how many people? 300 people are watching live. Yeah, so I'm going to put you on the spot to speak on the microphone so that everyone can hear and they can answer you. So, anyone have a question? Or are you just waiting for me to talk?
This is for Tiana. It's just for your driver's license. Sorry, it's not an application, but how long did it take for you to get that once you sent in your Canadian? I traded mine as well. The whole process, if you do everything, I made a few mistakes, but if you do everything right, it takes like 2 weeks to like just get it back in hand. You have to like get a document from the post office and send that to them along with the fee. It's like 30, 40 pounds, something like that. Your driver's license, and then maybe something from like the DMV equivalent in Canada or whatever, and you send that to them and they ship it back to you.
If you go to the government website, they'll mail you the document, and then you just fill it out. You go take a lovely photo of yourself at PB station, and then you go get a check from the post office, and that all took like 3 weeks because I also screwed it up and had to send it back.
And they can also get the document from the post office.
There we go.
And then for me, I also got my license out from Canada, but I started from scratch here, so I got my standard license here in the UK, so I could drive standard, which is also possible. I wouldn't necessarily recommend it, because it's very hard to figure out how to drive on the other side of the road standard, but it's definitely possible, and I've done it, and I've been driving for a year now, so that's an option too.
Yeah, the only thing is like just do it right the first time, because most of the time, like you waste time in the post. For some reason, you can't do it online in this country. You just have to like mail it to them. So it's like you lose 5 days when you ship something back and forth. Like that's the biggest like waste of time. Thanks.
And there's a difference if you're a Commonwealth country, so the Canadians are able to do this more readily. US is sort of like you got 1 year. And nobody really knows when that 1 year stops. No one can say. So we don't know. And the worst thing you want to be caught is if you're stopped and they ask questions, that's when you can really get in trouble. So that's the risk. Remember, if you have a flat tire and a police comes, they'll start asking questions running a license. So it's a gamble if you haven't switched, and it's a bit of a pain. And I think the waiting list for getting a test is quite long, so plan ahead. Now, the one thing that they didn't have, which you will have, is that we just bought 3 cars. Oh. So we're trying to figure out, for those that are stuck, like Group H5, who's Group H5? Right, so you guys already emailed me like off the bat. You don't have a car. So we're working through that, and there will be some system. You do know you have to know how to drive, and you have to have a license amongst you to be able to utilize it. But we have tried to resolve the issue that there are some location groups do not cover. So it only works. They're automatic.
What kind of car is it?
And I lost track because you know, the emails I got, like, we found this in the beach, we found this in the beach. And I'm like, just get formatted.
I should clarify as well, because technically you're not actually supposed to hold 2 licenses that I hold, so that's just be aware of that as well. I have no files and stuff out.
So you lost it.
I'm shy. Okay, well, let's give him a thanks for sharing his Right, so thank you very much. You're welcome to stay and enjoy the reception. All right, so we're moving on to the next part of the event here. So I'm here to share a few words. Because one of the things that we know, and the reason we created this, is because there's some people, well, hopefully most of you are quite excited. But some of you might be a little anxious, or even quite scared. So we know they're all brain, and we're trying to make sure that you feel supported through your journey, because we're all on a journey, and not all of you are in the same place. And that's okay. Some of you will need a little bit of more confidence, encouragement to feel like you belong. And that's okay. The reason we created a final year where you're under supervision is that it's a safe environment for you to try things, to explore things, to find yourself. But one of the things that drives anxiety is that people feel that they're judged all the time and that they are comparing themselves to others. That is the worst thing you can do. If you want to feel good, don't compare yourself to others, because you constantly be disappointed, because you don't know how to compete with that. People worry about like, oh, that person got a better supervisor. That person's got a better rotation schedule, or they have a better clinician. That kind of mentality just leads to unhappiness. One of the things that I told you before, it's going to be the hardest year. But it's the year that you learn the most. And when you graduate, that learning doesn't stop. You're probably going to learn even more the first year in practice than you do all of vet school. Why is that? Because there are different environments, different pressures, and different challenges. And the way we as humans improve is with challenges. If it was easy, you wouldn't improve. So you need to be under the conditions where you're constantly being challenged to improve yourself. All right? You are not a finished product yet. What we want you to do is focus on your better self and how you're going to get there. Knowing that it might take you different paces, and that's okay. So not all of you need to be at the same spot. All right? It's a journey. And we are here to get you there. So that's really our goal. And that's what this year is all about. Now, I've circulated the student oath. And that's something special for us because this is not downloaded from the internet. We composed this. So it was a group of students and staff at the RVC that came up with these words. So they mean something. These are RVC values. And hopefully you will share with us these values. But we wanted to sort of capstone this event with you taking this pledge. Because we want you to feel like when you walk in those clinics, that you are a clinical student, that you are not a passive visitor or observer. You are part of that team that's helping these animals in these families. So animals are brought to us, and they're trusting us and you. You should feel part of that collective responsibility to look after the animal. So there's always, every year, talk about the walkouts. They are a chore, but it's about shared responsibility. That animal needs care. They can't just walk themselves. So we're taking a shared responsibility in the care of those animals who you learn from. So you should look at it that way. Yes, it's annoying that 7 o'clock at night I'm walking this dog, but you also got to spend time learning from that animal. They could have gone elsewhere, but they chose to come to a teaching hospital, and you're benefiting from that. Right? So if you had no animals in a hospital, you wouldn't have to come in, you would learn less. You wouldn't know what to do in the middle of the night when you're in practice. What happens when there's not everyone else around? So it's a learning opportunity. Every day is a school day. All right? So, without further ado, I'm going to ask you to stand up. Right, so we're going to read together. And every year it has worked out pretty well. So it's just kind of funny how when you get in a group, people can read together. And so that's what we're going to do. All right? So in front of you, you have the certificates. And we're also going to project this here. And so that's inclusive with the color background. And hopefully, you can see the camera because your friends and family are looking at you. All right? Go ahead. Okay. So, when I count to 3. 1, 2, 3.
In honor of the years of hard work, sacrifice, and dedication that has brought us this far, as we embark into our clinical rotations, we pledge to uphold the ideals of honesty, integrity, scientific inquiry, and compassion imparted to us by our mentors. Behave in a professional manner, showing respect to our colleagues, patients, clients, and ourselves. Diligently assist the profession's endeavor to improve animal health and welfare. And finally, we pledge to constantly strive for improvement in our personal and professional growth through a commitment to lifelong learning.
So congratulations, class of 2026. Thanks again for coming and sharing this special event with us. And so now we're going to open up the reception. It's not fancy, it's pizza. But we also have the shop open, and you can also purchase sleeves for your certificates. So enjoy yourselves.
Oh, they can see us. Wait, which one's that? Should I like? No, it's not that one. Sit down. Wait, look. Which one is it? Sorry, I ruined your picture. My brother was like, come back to the camera. Hi, Mama. Oh wait, we have to go here. Oh, we are here.
You anyway. Okay, mighty fire.
Get your kisses, girl.
Oh, is it still recording?
Yeah, I think so.
Hey, wait, I wanted to say officially hi. Hello. Wait, gotta go. Like, where is it? There we go. It's upside down now. Thank you guys. Oh, did we make it? Dang it! Oh no!
Before I left the room, it said stop it, so I think it's going to stop.
I almost fell.
Okay. Hopefully she saw us running.
If not here. Yes.